This is a presentation on the Assessment of Basic Language and Learning Skills Revised, also known as the ABLLS, which is an update to the ABLLS that was published in 1998, and also a short review of the Assessment of Functional Living Skills, also known as the AFLS. This is the ABLLS Revised. The ABLLS is an assessment tool, curriculum guide, and skills tracking system that can be used to help guide the instruction of language and critical learning skills. The ABLLS contains a task analysis of the skills that are necessary for communication and learning from everyday experiences. The overall goal of the ABLLS is to refine the level of examination of skills so that teaching can occur in increments that are manageable and likely to result in meaningful and permanent gains for the learner. Therefore, each of the skills in the assessment is operationally defined with identified measurable increments. The ABLLS is for children on the autism spectrum and those who have been diagnosed with other developmental disabilities which affect communication and learning skills. While parents are always asked to seek input from qualified professionals regarding all programming decisions regarding their child's educational services, the assessment gives criterion-referenced information regarding current skills and provides a curriculum that can serve as the basis for the selection of educational objectives which should be used by professionals for programming. One does not need to become certified to administer the assessment. However, without an understanding of the behavioral principles underlying the ABLLS, the results may be less accurate and informative. The assessor should be someone who is likely to be objective about the learner and their abilities, and also someone who has had experience with children who have language delays and other maladaptive behaviors commonly associated with autism spectrum disorders. Many parents of children on the autism spectrum look for a tool to help guide them at home to help with the carryover of language and learning skills at home, which would be one of the main reasons why a parent may want to administer this assessment. Also, many children with autism often display a set of skills at school, but not at home. Therefore, parents of learners with autism oftentimes look for a way to track progress at home to compare to progress in school. Dr. James Partington, the Director of Behavior Analysts Incorporated, is the creator of the ABLLS. Dr. Partington has dedicated his life to helping children with autism spectrum disorders and other developmental delays for the past 35 years. His expertise is in language-based intervention and helping children develop the basic language and learning skills they need for everyday interactions. Dr. Partington developed the ABLLS and pioneered the inclusion of verbal behavior into applied behavior analysis in doing so. B.F. Skinner defines verbal behavior as behavior that is reinforced through the mediation of other people. Applied behavior analysis, also known as ABA, is a systematic approach to applying interventions to improve socially significant behavior. The ABLLS Revised is made up of two separate documents, the ABLLS Protocol and the ABLLS Guide. The ABLLS Protocol provides a list of skills, though it does not include a method to readily determine the educational priorities for an individual child, and it does not include the steps necessary to teach those skills. The ABLLS Protocol provides parents and professionals with criterion-referenced information regarding a child's current set of skills that can serve as a basis for the selection of educational objectives. The protocol also includes a set of scoring grids that makes it possible to observe and document the learner's progress in the acquisition of the skills. The protocol should not be used without the guide, and instructions for the use of the ABLLS protocol are provided in the ABLLS Guide as well. The ABLLS examines 25 categories of behavior across 4 skill sets. The skill sets include basic learner skills, academic skills, self-help skills, and motor skills. These are skill sets in which learners with autism have a greater need for support. The basic learner skills section assesses the categories of cooperation and reinforcer effectiveness, visual performance, receptive language, imitation, vocal imitation, requests, labeling, intraverbals, spontaneous vocalizations, syntax and grammar, play and leisure, social interaction, group instruction, follow classroom routines, and generalized responding. The letters assigned to each category in the skill sets booklet correspond to the scoring grid, which we will take a look at later in the presentation. The academic skills section assesses the categories of reading skills, math skills, writing skills, and spelling. The self-help skills section assesses categories of dressing skills, eating skills, grooming, and toileting skills. And the motor skills section assesses the categories of gross motor skills and fine motor skills. This is an example of a list of skills in the labeling category within the basic learning skills set section of the ABLLS protocol. Looking from left to right at the top of the table, you can see each task has a code. The code begins with the letter assigned to the category. In this case, the labeling category is the letter G, which corresponds to the letter G found on the scoring grid. Still looking from left to right at the top of the table, you will then see the scoring range, the task name, the task objective, the question the assessor should ask themselves during assessment, an example of the objective, the scoring criteria, and any notes for scoring the assessor should be aware of. The hierarchy of the ABLLS is simpler to more complex skills, which indicates that earlier skills within each category are prerequisites for the independent and maintained demonstration of the skills by the learner later in the categories. This has a practical impact on the use of the ABLLS in that gaps in skills that occur earlier in each category typically are given higher priority in the writing of initial goals for the child's treatment program. Learners with autism are often scattered in their abilities, and it's likely that when administering this assessment, the assessor may find that, for example, the learner may have the highest score, which is a 4, task G19, but may score a 1 on task G14. We will see an example of this on the next slide. This is an example of the scoring grid for categories A through I. You will see that at the top of the scoring grid, the assessor records the student's name, his or her own initials, the date assessed. Since the assessment takes more than a day, you may record the month and year the assessment took place if that is okay with your institution, if you are a professional with an institution, and the color code you will be using when you complete the assessment at that time, so the assessors and dates are clearly differentiated. This assessment should be given at least once a year or when professionals programming for a learner change. So skill acquisition for each year assessor is visible, and it is apparent what skills should be targeted next. This is an example of a student's completed scoring grid across 4 years and various professionals. The name of the student has been blacked out to protect his or her identity. This learner has autism and is currently 9 years old. Therefore, this scoring grid shows the learner's progress since he or she was 5 years old. You can clearly see an example of scattered skills in categories G and H. This assessment informed the professionals programming for this learner where they needed to fill skill acquisition gaps. This assessment informed the professionals of objectives that should be targeted on the learner's individualized education plan. Again, the ABLLS assists in guiding curriculum and tracking skills. The ABLLS guide provides instructions for scoring and completing the skills tracking grids. It also provides strategies to assist parents, educators, and other professionals to use the information obtained from the completed assessment protocol to develop an effective IEP for a learner. It also provides strategies for analyzing the scores to determine educational priorities and to help with the selection of educational objectives for an individual child. The R in ABLLS R stands for revised. ABLLS revised protocols and guide includes many new task items that were not originally included in the 1998 version. There have been multiple changes in the descriptions and criterion for individual task items as well as in the sequencing of many task items. The word new in the note section of a task indicates that the task has been added to the list of skills. Modified in the note section of a task implies that there have been changes made to the criteria, objective, question, or examples related to the task. The ABLLS may take up to 14 hours total to complete. Since the school day does not always go exactly the way we expect it to, in my experience, I have found the ABLLS may take up to 2 or 3 weeks of school to complete, depending on the learner's attention and behavior. The ABLLS protocol and guide set costs $64.95. The entire assessment kit, which includes all materials you would need to go with the protocol and guide, costs $1,495. And the electronic web version of the ABLLS, which allows for electronic scoring and sharing information with team members costs $100 for new users per student profile, and then costs $60 per student profile each additional year after. The ABLLS language skills are assessed based upon the behavioral analysis of language as presented by Dr. B.F. Skinner in his book Verbal Behavior from 1957. The ABLLS is not a diagnostic device. It does not compare the child to norms or the performance of other children. The ABLLS looks at fundamental skills in a simplest to more complex hierarchical sense. It breaks those skills down into components in order to facilitate the development of specific interventions. The interventions are designed to scaffold upon abilities already acquired by the child in order to increase their repertoire of skills. The ABLLS should be administered with 1-to-1 student to assessor ratio. Peers should be accessed when assessing social interactions, play, or any other category where interaction needs to be assessed. If tasks can be assessed during natural occurrences, the assessor may observe and record scores in an appropriate time. From personal experience, I go through the protocol in order, starting with the basic skills section. If I know I'm going to have the opportunity to observe the student completing or attempting to complete a task at a particular time that day or week, dressing, eating, fine motor, or interactions with others, I will hold off until then to obtain a score. That may mean that I am skipping around the skill sets booklets, but that's okay as long as each category is scored. The materials needed for the ABLLS are the protocol and guidebooks. A complete list of the numerous materials needed to assess can be found at www.shop.vbteachingtools.com. Most schools that use the ABLLS have purchased the entire assessment kit, which includes all materials needed. The assessment of functional life skills is the partner assessment to the ABLLS, also created by Dr. Partington in addition to Dr. Michael Mueller. The AFLS is comprised of the AFLS Guide and Assessment Protocols, which assess functional skills of everyday life, practical skills of everyday life, and essential skills of everyday life. It is an extended assessment that exists spanning throughout a learner's life in home, school, and community settings, which is also a criterion-referenced assessment and does not require certification to administer. Like the AFLS is comprised of skill sets with categories for assessment. The AFLS assesses functional, practical, and essential skills for everyday life. Each module is connected by unifying themes and overarching goals for maximizing a learner's independent opportunities. Bundle multiple modules and customize the perfect assessment for your setting and situation. The original AFLS set includes basic living skills, home skills, and community participation skills. The school's skills protocol is sold separately. Guides and protocols range from $75 to $105 depending on the module. The Basic Living Skills module contains tasks for assessment in the following categories: self-management, basic communication, dressing, toileting, grooming, bathing, health, safety, and first aid, and nighttime routines. The Home Skills module contains tasks for assessment in the following categories: meals at home, dishes, clothing and laundry, housekeeping and chores, household mechanics, leisure, kitchen, and cooking. The School Skills module contains tasks for assessment in the following categories: classroom mechanics, routines and expectations, meals at school, social skills, technology, common knowledge, core academics, and applied academics. The Community Participation Skills module contains tasks for assessment in the following categories: basic mobility, community knowledge, shopping, meals in public, money, phone, time, social awareness, and manners. This is an example of a list of skills in the self-management category within the Basic Living Skills module of the AFLS protocol. Looking from left to right at the top of the table, you can see each task has a code. The code begins with the letter assigned to the category. In this case, the self-management category are the letters SM, which corresponds to the letters SM found on the scoring grid. Still looking from left to right at the top of the table, you will then see the scoring range, the task name, the task objective, the question the assessor should ask themselves during assessment, an example of the objective, the scoring criteria, and any notes for scoring the assessor should be aware of. The hierarchy of the AFLS is also simpler to more complex skills, just like the ABLLS, which indicates that earlier skills within each category are prerequisites for the independent and maintained demonstration of the skills by the learner later in the categories. This is an example of the scoring grid and scores for some categories in the AFLS module. You will see that at the top of the scoring grid, the assessor records the student's name, his or her own initials name, the date assessed. Since the assessment takes more than a day, you may record the month and year the assessment took place if that is okay with the school in which you teach, and the color code you will be using when you complete the assessment at that time, so the assessors and dates are clearly differentiated. This assessment should be given at least once a year or when professionals programming for a learner change. So skill acquisition for each year assessor is visible, and it is apparent what skills should be targeted next. This assessment could also take 2 to 3 weeks to complete. Limitations of the ABLLS and AFLS may be the time it takes to administer the assessment, the numerous manipulatives needed to assess, and the fact that the learner essentially competes with oneself to master out objectives. In conclusion, these assessments are only as useful as the accuracy of the information that went into completing them, and the skill of the assessor in both completion and sorting through the potential skill targets for future goals and objectives. These assessments are useful if accurate information goes into completing the assessments, appropriate amount of time is given to assessing, assessor and instructor realistically assess and implement recommendations for each individual based on outcomes.